I'm Dr. Kelly Starrett with the Ready State. Our typical athlete and client here at the Ready State tends to be more athletic. We tend to see a lot of professional athletes. We tend to see a lot of people using their body for a living in a professional sports sense. But one of the things that we recognize is that everyone has the same sets of needs. To the extent that this is relevant to you, we're talking about how we utilize H-Wave to help decongest and desensitize pain in and around the shoulder. One of the problems we find with our athletic populations is that if I had a hip or a knee, it's a lot easier for us to get some non-exercise activity, to do something that look like, maybe a light walk or a spin on the bike while we're doing something else, to help decongest those tissues, to get just the musculature to clamp down on those lymphatics and move those fluids along. There is no commensurate sort of set of exercises that are equivalent for the shoulder or for the shoulder girdle, or even the arm. And so subsequently what we tend to see is that athletes who are very arm dominant, our swimmers, our water polo players, our throwers, we can give them decongestion recovery exercises that look low level and are easy to do and very zone one, but it's hard for us to get our athletes to actually engage in those things for the upper body. No one is going to go for an hour recovery swim. No one is going to jump on an assault bike or a rowing machine for multiple hours to help decongest, to create muscle contraction, to move along the waist that maybe was generated in the sport or in the activity. So one of the things that we get out of working with the H-Wave is that we can actually get much more targeted decongestion of these tissues. So if I have a sensitized tissue, once again, one of the sort of first orders of operation for us is to say, can we remove waste? Can we improve blood flow? Can we take the garbage out and bring the groceries in? And will that help the athlete have experienced less sensitivity in this area? And oftentimes our experience is, yes, that once we really do get ahead of some congestion and swelling, the athlete oftentimes finds that congestion and swelling was a sensitizing agent, and we end up feeling a lot better. What's nice about, again, using something in H-Wave for the upper body particularly is that we can get many, many hours of decongestion. And it would be impossible for us to get that level of low-level activity for an athlete to sort of decongest herself after a big game, especially when we're playing multiple games or have multiple sort of events stacked up in a few days, or even the same day. So again, one of the reasons we love H-Wave is that it's easy to slap on the pads and start to pump while I'm on the bus, while I'm hanging out at Whole Foods in between events, while I'm even just sitting around or waiting around for my team to sort of get the next call up. We can be decongesting and actively staying ahead and managing that adaptation response to the exercise, reducing that session cost to the training or the effort. So again, we love H-Wave because it allows us to have our athletes do nothing but still be active and decongesting their bodies.